All right, welcome everybody. Thank you so much for spending your evening with us. If you are here for the National PKU Alliance webinar on identifying and managing mood and executive functioning deficits, you are in the right place. We have a good crowd coming tonight, so I'm going to go ahead and just make sure we give people a chance to join. All right. All right, wonderful. Okay, so we have looks like we have about 23 so far, and we'll probably have people joining here in the next 5 minutes or so as well. So thank you so much all for being here. We really, again, appreciate you taking the time out of your evening to spend some time with us. My name is Susie Gray. I work for National PKU Alliance. I am the Director of Development and do some things on the operations side of the house as well. And I am pleased to be welcoming Dr. Eugene Lubliner here with us tonight. Many of you know Dr. Lubliner in many different ways with his work through National PKU Alliance and other avenues as well. We're so happy to have him here. And he's going to be starting his presentation here in just a minute. I'll do a brief introduction. He really needs no introduction, but I'll go ahead and give one anyways. Dr. Lubliner is a New York State licensed psychologist, board certified behavior analyst, and certified school psychologist. He also is a proud parent of two kids. His daughter is 10 years old and she lives with classic PKU. So we're so just pleased to have him here with us tonight, just from learning from his expertise, both as a parent and in his profession as well. I will go off video and turn the floor over to Dr. Lubliner. And again, thank you so much for being here.
Oh, thank you for that introduction, Susie. I really appreciate it. Good evening, everyone. Um,
And 1 second, I forgot to mention, I'm going to have just a quick Q&A for Q&A tonight. I'm sorry to interrupt you.
no,
I just
no,
want to make sure I mentioned this just so everyone was familiar. Um, we will do Q&A at the end of the presentation. So you can go ahead and put your questions, if you think of them, in the Q&A tool. If you want to just note that, and then we'll be taking those at the end, and we'll make sure to allot plenty of time just to cover those at the end of the presentation.
absolutely. All right, now, good evening, everyone. I'm so glad to be here tonight with you. I'm gonna share my screen. Give me one moment. Okay, and then if I do this. All right. I hope everyone can see the screen. It looks right on my end. Um, Again, I'm so happy to be here tonight. My name is Eugene Lubliner. And just like Susie said, I am a psychologist out living in Long Island in New York State. Um, I've been a school psychologist now for 18 years, also in private practice, and also happen to be the parent of a child with classic PKU. So, as I like to say, it's a real intersection here between my family life and my professional life. So I'm really happy to present to you tonight about identifying and managing mood and executive functioning deficits. Um, Before we get into it, I want to make it very clear that today's presentation isn't about diagnosing disorders. It's about understanding some of the most common mental health and thinking challenges that people with PKU experience and recognizing when they may be occurring and learning some practical strategies that can help and hopefully bringing about some understanding for everyone here and making sure we can always point you in the right direction. So why are we talking about mental health? Well, people with PKU are more likely to experience anxiety, depression, and executive functioning difficulties. And when we say executive functioning difficulties, we're talking about ADHD-like symptoms. But there's good news. these type of symptoms are common for many people, not just people with metabolic disorders. These things are very treatable, and you are certainly not alone if you are one of the people experiencing one of these, disruptions throughout your day in your mood or executive functioning. And what are we going to be covering today? Well, we're going to be talking about understanding symptoms of anxiety, depression, and executive functioning deficits. We're going to review some simple behavior strategies, simple tools and activities that you can use to address your mood and address your executive functioning. Some key questions to ask yourself to check in with yourself about how you're thinking and feeling, and to identify when and more importantly, how to ask for help. And there's one thing that I want everyone here to remember before we get started. You are the expert on your own experience, your own thoughts, your own feelings. And this presentation is designed to help you recognize symptoms, to understand how PKU can affect mood and thinking, and to learn practical strategies. But it's not intended to replace evaluation by your metabolic team or a mental health professional. We want you to seek out help if you're really experiencing something significant. So let's talk about understanding symptoms. We're going to start with depression. And what are some common signs of depression? You may experience things like feeling sad, empty, or hopeless, losing interest or enjoyment in activities that you usually like, feeling tired or lacking energy, changes in sleep habits, either sleeping too much or sleeping too little, changes in appetite or weight, and again, either means either gaining weight or losing weight, difficulty concentrating, making decisions, feelings of guilt, worthlessness, or overly critical, moving or speaking more slowly, or feeling unusually restless, or thinking about that life isn't worth living, or having even, thoughts of self-harm, death, or suicide. Um, right off the bat, when we're talking about depression, and you're going to hear me say things like this a lot, talk to your healthcare provider if these symptoms last more than 2 weeks, or if they're interfering with your work, with your school, with your relationships, or with your ability to complete daily activities. And I think this goes without saying, but I wouldn't be doing my job if I wasn't saying it. If you're having thoughts of harming yourself, or if you really do feel like life is not worth living, please seek immediate help with a trusted person, a healthcare provider, or an emergency service like the emergency room 911. And what are common signs of anxiety? Well, you may be experiencing anxiety if you notice excessive worrying that's difficult to control, feeling restless or tense or on edge, trouble relaxing, difficulty concentrating or your mind going blank, feeling irritable more easily than usual, constant muscle tension in your shoulder, jaws, or headaches, tension headaches, trouble falling asleep or staying asleep, feeling tired even after you're sleeping. And again, if you're seeing these symptoms persist for weeks on end, or if they're interfering with your work, with school, with your relationships, please seek out immediate assistance from a healthcare provider. And then when we're talking about ADHD, when we're talking about adults in particular struggling with ADHD, we're talking about executive functioning more than like hyperactivity. And when I say the words executive functioning, I'm not sure how many people are familiar with that term, but I want you to think about the executive of a company. The boss develops a plan of action, sees tasks through to make sure that they're completed, adjusts things as necessary if they're not meeting goals. So that's really analogous to what executive functioning is for a person. Um, Deficits in executive functioning could include trouble staying focused in conversation or during reading or long sustained tasks, becoming easily distracted, frequently forgetting things like appointments or to-do lists, um, trouble organizing or planning your activities, starting projects but not seeing them through to the end, frequently procrastinating, especially on tasks that are effortful, feeling mentally overwhelmed by tasks that seem manageable by others, poor time management, or consistently running late. You may also experience restlessness, constantly needing to stay busy, interrupting others or speaking impulsively, and difficulty waiting your turn. Um, One thing to remember is that true ADHD diagnoses, the symptoms usually begin in childhood, even if they're not recognized until adulthood. And for people with PKU, especially during periods of elevated Phe levels, you may experience deficits in attention, memory, and executive functioning that look like ADHD. But if the symptoms have worsened recently, it's probably more appropriate to discuss this with your metabolic team and get your Phe levels and check in with your diet and your medication regimen. So, how does this relate to PKU? How can PKU affect your mood and your thinking? Well, for starters, elevated Phe levels can affect your brain chemistry. And it's pretty well shown that even people with well regulated Phe still have some deficits in their executive functioning compared to similar age peers. And let's also not forget that just the act of managing PKU every day is very stressful all by itself. So there is a lot of overlap here, both from a physiological standpoint and just from the activities that people with this condition or caregivers of people with this condition have to engage in. I also want you to understand that all three of these things that we're talking about tonight, anxiety, depression, ADHD, there's a lot of overlap in the symptoms. They all swim in the same pool, as I like to say. You may have noticed when I was describing symptomology, feeling depressed, feeling anxious can really cover a lot. Irritability is symptomatic of both ADHD and depression. Restlessness is symptomatic of both ADHD and anxiety. Sleep disturbances, mood lability, where you're crying more than you usually do, are symptomatic of anxiety and depression. There's just a lot of overlap here. In fact, research indicates that approximately 80% of adults with ADHD also meet diagnostic criteria for one other psychiatric condition at some point in their lifetime. Usually, we're talking about anxiety or depression. So, I kind of just reviewed some of the symptoms that you may experience. And now I want to talk about simple behavior strategies, things that you can do for yourself that may lessen some of these experiences. So we're going to start with depression. Strategies for depressed mood and anxiety are things like mindfulness exercises, gratitude journaling, and progressive muscle relaxation. And these are three very simple strategies that I think can be very helpful for you if you're experiencing any of these things. What is mindfulness? Let's start with that. Mindfulness means, in its simplest form, paying attention to the present moment with curiosity rather than judgment. Just being present, thinking about how you're feeling, and not putting any value on it. Just labeling and understanding what you're feeling in that moment. Nothing is right or wrong when you're talking about mindfulness. By maintaining a neutral, present, focused state of mind, you can reduce feelings of depression and anxiety in that moment. So, what I'd love to do right now is practice some mindfulness exercises. Now, this is a workshop, so I can't see any of your faces. So, I am holding you to the honor system that you were going to practice this with me right now. One way to just slow your body down and become a bit more mindful of the moment is to do square breathing. And I have this illustration right here. I want you to think about a square. Breathe in for 4, hold for 4, breathe out for 4, hold for 4, and then repeat. So we're going to do that right now. All right. I'm going to count off while I'm breathing and holding. We're going to do 3 square breaths. That was 3 square breaths. And we know that we're holding for 4 seconds, breathing in for 4, breathing out for 4. So we know that each 1 square breath takes 16 seconds. So that was under a minute of square breathing. But in that very short time, it can help you relax, refocus, and center yourself. Another mindfulness strategy that I like to employ is the stop technique. So the next time you feel your mind racing, think about the acronym STOP. S, stop what you're doing, put whatever it is down for a minute. T, take a breath, take a normal breath, breathe in, breathe out. Now would be a great time to take a square breath. O, observe your thoughts and feelings. Allow yourself some time to be aware of your experience in that moment, how you're feeling physically, emotionally, mentally, again, without judgment, just labeling. And then P, proceed with something that will support you in the moment. Maybe that's a 5 minute text conversation with a friend, or taking a short walk, through the hallway of the office, or continuing a brief meditation, but something that will just bring you a little moment of reprieve so that you can then return to whatever it is that needs to be accomplished. Another strategy that I love is gratitude journaling. Um, this is gratitude is the concept of gratitude is being thankful, showing thankfulness and joy in response to receiving a gift, whether that gift is tangible by a benefit from something specific, or a peaceful bliss that's evoked by natural beauty. The goal of gratitude journaling is to increase your trait gratitude, to increase your, mindset of being continually grateful. When you have a disposition towards gratitude, it changes your life orientation to help you notice and appreciate positives in your life. So, gratitude journaling is a way to just promote keeping a gratefulness mindset. So, some ones that I've employed in the past and that I encourage other people to use as a prompt is are things like write down one good thing that happened today. Name 5 things you're doing well currently. What is something nice you did for another person today or this week? What were your 3 best days? Write a small paragraph about each day. Think about a person that irritates you or you have trouble getting along with. What irritates you the most about them? Now list 3 positive notes or qualities about this person. Think about the worst period of your life when you went through it and list 10 ways that your life is better now than it was then. List 3 things that you could do today to be a kinder person. What is the most beautiful place you have been to? Relive being in this place now. Spend a few minutes focusing on your 5 senses and write down how you can be more mindful of each, or make a list of 20 ways that you are fortunate. I think people hear journaling and they get very intimidated. This isn't anything that's meant to be shared with anyone. We're not looking for the great American novel. It's just a way to reorient yourself to be thankful for the things that you have around you and reprocess some things that may have been very anger provoking, stressful in your past, but seeing the gratitude in each moment of your life. Another strategy that I like to employ for anxiety and depression is progressive muscle relaxation. Progressive muscle relaxation is a strategy that makes use of something we call the mind body connection. When we normally think about our thoughts, it's a top down process. Um, you know, I was thinking about that mean thing that my friend said to me, and now I am angry. So I had the thought, my body carried out the thought. But body sensations also influence the mind. So think about this sentence and think about what's silly or impossible. I was in pain, so I stepped on a nail. That's not how it works. You step on the nail first, and then you feel the pain. So that's an example of input being given to your body, and then your brain interpreting that input. So progressive muscle relaxation, in a way, hijacks that mind body connection. By forcing your body to calm down, your mind has to calm down. And when you practice techniques like this daily, it has been shown to be very effective in reducing stress and anxiety. So we're going to practice a little bit of progressive muscle relaxation together because I really do love torturing you. Let's start with an example of an adult one, and I'm going to make sure that I am sharing my audio as well. Give me one moment. Okay. Sorry, give me 1 second. Audio, there it is. Okay, good. All right, this should work. If it doesn't, then we will skip it, but let's try. Settle down comfortably, lie down or sit down. Make sure that your back and neck are adequately supported. Now, did you guys hear that? I don't know.
Yep, that one came through, Eugene.
Okay, great. Thank you. I
Yep, you can
apologize.
keep going. No, you're good.
Straight away, just let go of every muscle in your body. Try to let your body just go limp and loose, pleasantly limp and loose. Now let's do some tension relaxation contrasts. Begin clenching your right fist. Let the rest of your body relax to the best of your ability, but your right fist is tight and clenched. Now study the feelings of tension in the right fist. Notice the contrast in the rest of the body. The right fist visibly more tensed. Now bend the right arm at the elbow so that your biceps muscles tense as well as the wrist. And notice the discomfort, the tension feeling. Now do the opposite of tension, just relax. Let the arm down to your sides. Make sure your legs are uncrossed, arms at the sides, unclench the fist.
I got to tell you, it was very smart of me to work in a progressive muscle relaxation routine in the middle of my presentation. Keeps me very calm for you guys. There is
Comes
oh, there is
settle
a
down
oh
comfortably
no.
supported.
There is a child version as well that we can share. And just so you can get a flavor of, a kid appropriate version of progressive muscle relaxation, I'm going to play a little for you right now.
We're going to start by closing our eyes and taking some deep breaths. One at a time, I want you to breathe in and out, feeling the breath on the back of your throat as you breathe in. Breathe in through your nose and out through your mouth. Let's breathe together. Breathe in and breathe out. Breathe in and breathe out. Take nice deep breaths. Pretend your lungs are like little balloons, and every time you breathe in, your lungs fill up with air. Now try taking slower breaths. Breathe in and breathe out. Breathe in and breathe out. Notice how your breath feels as it hits the back of your throat. As you slow down your breaths, you begin to feel so nice and relaxed. You're doing a great job.
So that's an example of a child appropriate muscle relaxation exercise. Um, To that end, these type of activities are appropriate for people of all ages, and with practice can make you quite adept at just calming your mind and body down in the moment.
We're going to start
Oh,
by closing our eyes.
there we go. So now we're going to move on to strategies for executive functioning. And the three that I'm going to briefly go over is externalizing your schedule, using graphic organization, and just one more bit on mindfulness as well. Externalizing your schedule is very simple, but not easy. So here's an example of one of my calendars and how necessary it is for me to externalize my schedule, because if it's not in my digital calendar, it's not getting done. Um, so really, one of the biggest stressors in life, and one of the ones that can become very compounding in our day-to-day experience, is if we don't know where we're supposed to be at any given moment, or if we're losing track of where we're supposed to be. And so the big events, if you can externalize your schedule, really do help with that. But it is a discipline that you have to develop in order to truly benefit from an externalized schedule like this. Another thing is using graphic organizers. Um, when you organize complex information graphically, where the person has a whole external organization strategy, it increases the likelihood that you're going to see a task through to completion. Um, and there's a lot of research done with improving executive functioning of adolescents with severe food allergies by giving them a structured graphic food journal to help them maintain diet compliance. And obviously, that's very analogous to what we work with. So here's an example of a graphic organizer for food journaling. Um, you know, just it is exactly what it seems like. Putting your fee allowance at the top, your formula goal at the top, and then graphically organizing your meals throughout the day, breakfast, lunch, snacks, and dinner, to make sure that you hit your targets. Another graphic organizer that I like is the Go Plan Do Review. This is to help plan out complicated tasks like homework assignment, chores, and I really do. I use it a lot. So again, very simple, but just shows how it can break down this decision-making process into its component pieces and keep you mindful of what you need to do and when it needs to be done. So, what goal am I trying to accomplish? What materials do I need to accomplish that goal? What are the steps to accomplish that goal? How well will I do? This is actually an example of a school-based one, but it's very easy to do a self-rating and a parent rating, or a self-rating and a partner rating. How well will I do? How much of this will I get done? Um, and then you do it. What problems have arose while I've been completing whatever the task is? What are the solutions to each of those problems? And then you review. How did I actually do? What worked? What didn't work? What will I try the next time? It's just a way to formalize this and prepare you for the next time you have to encounter whatever the task is, so that you are just a bit more prepared for any pitfalls. And then finally, mindfulness and its effects on ADHD. Mindfulness helps your attention filter. And selective attention is very important. It's the ability to focus on one relevant thing while ignoring distractions. So when you do mindfulness exercises like breathing, focusing on your body sensations, it requires you to filter out all of the irrelevant stimuli. And by practicing that, your brain gets better at paying attention to what it has to pay attention to and ignoring the things that need to be ignored. So, in other words, mindfulness reduces automatic distractions. Um, People with ADHD, people with anxiety often have increased distractibility because your brain is just reacting quickly to internal things like your thoughts and your emotions, and to external things like sounds or movements in your periphery. Um, when you practice mindfulness, you learn to notice the distraction, label it for what it is, and move away from it and move on. Strengthening selective attention is very important for executive functioning. So, where do you start? The best way to start is to choose one small thing, one small strategy, and put it into action this week. Put an appointment in your calendar. Use reminders on your phone. Keep a to-do list. Visually break down a large task you have to complete into smaller steps. Or review tomorrow's schedule tonight. One small change can really create a tremendous ripple effect. And now some final strategies to consider that are really appropriate for everything that we've discussed: anxiety, depression, executive functioning. Physical exercise is actually very important. Um, Low level resistance exercise, 45 minutes a day, twice a week, has shown to significantly improve executive functioning. Regular low intensity home exercise reduces anxiety and depression almost as effectively as medication alone. Um, it's a very powerful result. And also multimodal support. What does that mean? It means get your team involved. For any of these things, if you are experiencing any of these difficulties, talk to your family, visit your doctor, take the jump and go to therapy, or discuss the possibility of medication with a healthcare provider, or do a combination of all four of those things. Because the more support you have, the greater likelihood of being successful in reducing these symptoms. Now we're going to talk about some questions that you should be asking yourself. When we're talking about, you're feeling anxious, you're feeling depressed, you're feeling distracted and not able to focus and attend, um, there's a couple of things that you want to do to check in with yourself. First, some PKU specific medical and dietary questions. How consistently have you been able to follow your diet recently? How often do you check and monitor your Phe? Have there been any recent changes to your diet, to your formula, to your medication? Are you taking your formula as prescribed? And if you're not, what are the barriers? What is making that difficult right now for you? Have you noticed any issues with mood, anxiety, or tension getting worse when your Phe levels are higher? Do you notice improvements when your Phe levels return to their target range? Have symptoms changed during periods of increased stress or big changes in your routine? And then finally, what have your recent Phe levels been like? Have they been higher or more variable than usual? Have you recently been sick, under increased stress, or eating differently than usual? And have there been any changes to your treatment plan that could be affecting how you feel? There's also obviously some specific emotional and psychological questions that you should check in with yourself. Um, these are questions that help you reflect on whether the symptoms are related to PKU, or is it life stress, or is it another mental health condition? When did I first begin noticing symptoms of anxiety or depression? Are there specific situations or events that seem to trigger these feelings? Am I feeling overwhelmed by managing PKU or my treatment routine? Have I noticed changes in my sleep, appetite, energy level, or motivation? Have these feelings been affecting my work, school, relationships, or my daily activities? How do I usually cope with stress? Has this changed recently? Do I feel supported by my family, my friends, and my healthcare team? What activities or strategies help me feel calmer or improve my mood? And is there someone I feel comfortable talking to about how I've been feeling? And everybody has a different someone, by the way. Um, Finally, just a couple of executive functioning questions to check in on. Am I having more difficulty concentrating than usual? Do I find myself becoming distracted more easily? Is it harder to follow conversations, instructions, or complete tasks? Am I forgetting appointments, losing track of things, or misplacing things more often than usual? Am I having more difficulty planning, organizing, or completing everyday tasks? Do I feel more foggy or slow than usual? Am I feeling overwhelmed by tasks that normally are manageable? Is it harder for me to manage my time or stay organized or meet deadlines? Um, and do these attention or thinking difficulties come and go, or are they fairly consistent? Have I noticed these symptoms getting worse when my Phe levels are higher or during times of increased stress? And have these changes begun affecting my work, school, and daily responsibilities? Just remember that managing PKU can be demanding. Daily responsibilities of treatment, just the fact that you have to manage PKU can contribute to your stress, your anxiety, and be detrimental to your mood. So you should check in with just the management of the treatment. Am I feeling overwhelmed by the daily demands of managing PKU? Is it difficult to stay consistent with my diet, formula, and treatment? Do I avoid social situations because of food or concerns about explaining my PKU? How much is PKU affecting my work, school, relationships, daily activities? Do I feel like managing PKU is becoming emotionally exhausting? And is PKU interfering with my quality of life? And if it is, what's one change or source of support that I could access to make things a little easier? And then to wrap things up from my presentation piece of it, just helping yourself and knowing when to ask for help. First, let's talk about self compassion. Okay? People with PKU often place a great deal of pressure on themselves. I want you to remember that managing PKU is hard, and it's okay to acknowledge that some days are more challenging than others. The struggle of managing PKU, however, does not define you. Experiencing anxiety, depression, or difficulty focusing does not mean that you're failing. Perfection is never the goal. You're going to hear me say that over and over again. And I want you to treat yourself with the same kindness that you would offer a friend. Replace self-criticism with understanding and encouragement. And remember that you're not alone in this. Many people living with PKU experience similar challenges, and support is available. I said it already, but I'm going to say it again. Perfection is not the goal. Missing a diet goal, having a single high fee level, that doesn't erase the hard work that you do to manage your conditions. Um, and if I could encourage you to inhabit one mindset, the mindset is I'm doing the best I can, and it's okay to ask for help when I need it. I'm not looking for perfection. I'm looking for consistency. And that is what's going to help you be the most successful. Um, Another thing that I encourage you guys to do for help is to talk openly with people you trust. Okay? Talking about experiences can help you better understand what you're feeling and help connect you with the support that you need. You don't have to manage everything on your own. Sharing your concerns is a sign of strength, not a sign of weakness. So consider talking with your metabolic clinic, your healthcare team, a mental health professional, a family member, or a close friend, or if you're fortunate enough, another person living with PKU through this community. And be honest with yourself about changes that you've noticed in your mood, anxiety, in your attention, or your daily functioning. Because the more your healthcare team understands what you're experiencing, the better they can help you determine whether your symptoms are related to PKU, life stress, or a mental health condition. And quite honestly, very often in life, it's a combination of all those factors. And your team will help you parse out how best to affect positive change. I want everyone just also to take a moment to appreciate that relationship between PKU and mental health. Um, Even though your mental health symptoms can be influenced by PKU, they're still very real and they still deserve attention. Yes, elevated Phe levels can affect brain function, which makes it harder to concentrate, regulate emotions, and think clearly. And yes, the daily demands of managing PKU can contribute to stress, anxiety, and low mood. But like I said before, while the mental health conditions may be related to PKU and life stress, there may also be an independent mental health condition that would happen regardless of these combination of factors. Just regardless of the cause, you deserve to pay attention to and treat these symptoms. Experiencing anxiety, depression, or difficulty focusing is not a sign of weakness or failure. They're common challenges for people living with or without PKU, and effective support is available to help. And you heard me say this in the beginning, but it is very important to really immediately contact your healthcare team if You feel any of these symptoms that we discussed lasting more than 2 weeks, if they're interfering with work, school, your personal life, if you stop enjoying things that you know you enjoy typically, if you're struggling with your PKU treatment, or if you're just worried about yourself, and immediately seek emergency help if you're having any thoughts of self harm. So, what's the take home message? Mental health is a part of PKU care. Anxiety, depression, and attention problems are common, and the symptoms are very treatable. Small changes that you start as soon as you're ready can make a very big difference, and you never have to manage these things through PKU or your mental health alone. Thank you, guys.
Thank you. That was fantastic. And we have several questions to get to, so I'm going to jump right to it.
Okay.
This is great. Thank you. And I'll just to put a reminder, the Q&A function, it looks like it's working, which is always
Yep.
fantastic that technology is on our side. We're going to try to get to as many questions as possible. So first one, so for the mindfulness exercises, does it have to be an internal thing you focus on? So when you were kind of going through the steps there, so maybe give an example of if it's internal only, or some examples if you can shift that externally.
I mean, being mindful is a matter of staying grounded in the moment. Some people do find it easier to focus on the external environment. Hold on, I don't know if I'm sharing my screen still, and if I am, I apologize.
You are. Mhm.
Okay, hold on a minute. Sorry. There it goes. Stop share. Hi, everyone. Being my practicing mindfulness, you can focus on your internal state of mind or your external environment. Grounding yourself with how your feet feel on the ground. What are you making physical contact with? Is it a table, a chair? The focusing on specific sounds that you're hearing within the room. Um, I think my bigger message is practicing staying grounded and present in the moment is going to help you to process and understand what you're feeling in that moment. And I do think it should include some internal component, of your thoughts and feelings, particularly if you're struggling with hypervigilance of anxiety and just being distracted by a lot of racing thoughts. Um, Do you want me to just go down through the Q&A? Oh, you're muted. I'm sorry.
Okay, sorry. I forgot that you can see them too.
Yeah, yeah.
Yeah,
I'm looking at them. I can go right down if you'd
perfect.
like me to.
Okay, yeah, no, go right ahead.
All right. Could individuals with PKU receive an ADHD diagnosis, but it's just fee level changes? That's a great question. Has it happened before? I'm certain it has. I think it is an example that you bring up of why it is so important to have a multi-person support team where, like, it's not just enough to go to your general practitioner or a psychiatrist, psychologist, neurologist and get an ADHD diagnosis. It has to be done in the context of, your metabolic health. And I think it really does have to also include monitoring how your executive functioning is playing out, tied to your fee levels. So could someone receive that diagnosis and in reality they just have high fee? I would imagine yes. So I think it becomes incumbent upon you as the patient, or if you're the caregiver of someone, to really loop all the doctors in and make sure that everybody is on the same page there. Does the low intensity 45 minutes twice a week, does it have to be only twice a week, or can you spread it out? That was just me citing the research. In the research article that I cited, they looked at people that were doing low intensity for 45 minutes twice a week, compared to nothing. Um, my advice to you, this Emily, you named yourself. Hi. My advice to you is anything is better than nothing. So if you can get some sort of regular physical activity, that will be very important thing for improving mood and executive functioning. The more, the better. The research that I cited does show that it was twice a week. Do you get more sick frequently when you have higher levels? That's a good question. That's a little bit outside of my realm of expertise. Um, that's more of a question for your metabolic team. I have an N of one. I have a single case study in my house, and what I can say is that in my own house, when phi levels are a little off, it does make it harder to regulate your emotions. And so, that is problematic. I don't know. I don't know the specifics of the question you're asking. I don't know if you mean physically, actually medically sick, or you're talking about more emotional issue. Um, but a little bit outside of my realm. I apologize. Can adults with PKU have ADHD as well as PKU? Yes, they can. Just like adults with PKU can have depression and can have anxiety. I think that's an important thing to have a conversation with, again, your metabolic team and with another outside professional, either a neurologist, a psychologist, or your general practitioner. PKU adult here with my husband. How can he help support my PKU treatment as it pertains to anxiety, depression, ADHD, and diet management? Okay, well, now we're now we're getting into it. My advice to you is this, without becoming your marriage counselor, my advice is ask for specific help. Um, there is a difference between can you help me out with my food tonight? And I would like you to prepare my salad and my formula this evening. Um, Ask for specific help so that everybody is on the same page with what it is you're looking for and what it is you need. And the more specific you can be, I think the less ambiguity for you and your husband, and the more likely you both are to be very happy with the interaction. How well would lumosity help in relation to PKU? I think I know what you're talking about when you say lumosity. That's the cognitive training, I think. Um, um, you know, Executive functioning brain training games are never a bad thing. I don't really know the efficacy of lumosity specifically with PKU related conditions. However, it is certainly a brain training exercise game that has mixed um, efficacy out there in the field. I wouldn't say no to it. Again, I think that's a discussion to have with your specific medical team. What suggestions do you have for procrastination and tasks that seem overwhelming? Excellent question, Sarah. Um, Again, going back to those executive functioning strategies, that think, plan, do sheet, if you know that you're prone to procrastination, one of the best ways to address that is to just prepare. Write out the steps of what need to be accomplished and the order that it needs to happen. Um, Talk about and acknowledge what parts of the process are the overwhelming parts. Without knowing what you're specifically procrastinating on, I can come up with, a very general hypothetical, but let's say I am preparing to go out to dinner with some friends. I have PKU and I'm preparing to go out to dinner with some friends. And I'm procrastinating for that preparation. Well, what part of it is overwhelming for me? Is it the social act of going out? Is it the PKU act of planning what it is I'm going to eat? Going onto the website, checking out the menu, making sure there's something appropriate for me? Is it the act of interacting and asking for help from my friends? Like, oh, maybe we should pick a different restaurant. I don't know if I really can go there. Breaking it down into the steps that need to happen, what specifically it is that overwhelms you is the best way to address that procrastination. Um, how does mental health and PKU management change during the postpartum period? Oh, uh, another great question, but unfortunately a little outside my wheelhouse again, and I apologize, but it's a great question. And it is very pertinent and relevant to a lot of people, especially because we have so many new treatment options available, some of which have, already been determined to be safe to take during pregnancy, some of which are not. I just know from speaking to members of the community, some people choose to stay on their treatment plan, their medication treatment plan while pregnant. Some choose to come off and manage through diet alone. And that's a great discussion. And I think a very important one to, again, have with your metabolic team and make sure that you are looping in your OB and your OB team with metabolics to make sure they're both talking to each other and can really come up with the most effective treatment plan for you during the pregnancy and postpartum.
Yeah, and with that one, I noted your name here. I think it's Carly. I may send you some information. We had a separate webinar last year around maternal PKU specifically, and so I'll send that information to you. And that'll be on our YouTube channel. But I will definitely get that to you just in case that could be a great resource for you as well.
That's great. All right. All right. I think I
Okay.
went through all the questions.
I think we got them. And I think I was going to ask if I could, because there's
Please.
so much great information in here. And you may have mentioned this, but I'll ask again anyways. So in some of these strategies, how long have you seen, what's a goal for people to set for themselves on how to keep this in practice before it becomes a habit, it starts sticking?
Well, the analogy that I give a lot of people is I want you to think about, I imagine most people in this audience drive a car. And I imagine most of the people in this audience, when they're driving that car, they just kind of get in and drive at this point. So, like, if you're at your home and I tell you, go drive to where you work, you could just get in your car and drive there and give it very little thought. And when you think about it, you're doing like 15 highly complex tasks at the same time, but you're not really aware of a lot of it. You're moving your feet to accelerate, to go off of the gas, and that sometimes to apply the brake. You are navigating visually. You are manipulating the steering wheel. You are looking in some three mirrors and straight ahead at the same time. Um, you may even be changing the radio and listening to music at the same time. It's a highly complex task that you don't think about because you haven't just learned how to drive, you've overlearned how to drive. You've learned it to the point that it is just completely automatic. Um, the goal with a mindfulness strategy or progressive muscle relaxation is not just to learn it, but to overlearn it. So that then when you find yourself in that moment of stress, you're employing some of these things without even really expending a lot of effort to think about it. You know, Gratitude journaling, same thing. If you engage in the deliberate act of journaling over and over and over again, eventually your mindset just changed and you are automatically just having a gratitude mindset. So I guess the short answer is there's no specific amount of time, but the goal is to do it enough so that you don't just learn it, you overlearn it.
No, that makes sense. And I liked what you mentioned earlier about just start with one thing, not try to implement too many things all at once.
Absolutely.
Okay, I don't have any new questions. Maybe I'll ask one more. I love seeing the externalizing your schedule. And so I think you shared a few different, maybe I'm not sure if that was your calendar, an example,
Oh,
but
it sure was.
yeah. And I know it's like some color coding in there, but just either with what you've used or what you've seen your clients use. Are you just kind of talking kind of old school tools within Outlook or Apple, or
I'm
are there any
talking
other ones that are really
I
helpful?
I'm talking old school. I'm talking
Hmm.
whatever works for you. I
Yep.
mean, we have in my own house a tale of two cities. I
Hmm.
need everything on my digital schedule
Hmm.
because I need to be able to look at it on my phone, sometimes on my laptop, sometimes, checking in from my computer at work, and I need to be able to edit and modify on the fly. And I couldn't possibly carry a physical calendar with me. My wife, in complete contrast, needs a pen and paper written schedule. She carries, a daily planner that's, the size of a medium-sized unabridged dictionary,
Mhm.
and that's how she has to externalize her schedule. I'm not specifically endorsing any one mode of that. I'm just saying do something that works for you.
Nope, that makes sense. Let's see. Okay, and I guess access to all this great information. So the slides. So obviously we'll be posting the
Oh yeah.
recording on YouTube. But we can definitely, Eugene, are you comfortable with sending the slides
Oh,
out to our
absolutely. I'll share those
distribution?
slides with you tonight.
Okay, great. Yep, always a good question. I know. I think I was trying to grab my phone and like take a picture and screenshot a couple things with some
Don't
of the
worry,
ideas. So
Steve, your
great.
wish is my command. You're getting
Okay.
access to the slides. Don't worry.
Okay, great. Okay, well, I think that pretty much puts us at time. We're just a little bit short, but I think we covered a lot of really great information. And Eugene, thank you so much for taking the time with us. This is all really, really helpful and really great reminders on some things that we may have heard, but also some really some new information. I think that are just really gives us the
Well,
confidence to move forward. So thank you.
and it was really my pleasure. This is obviously topics that are very personally near and dear to me. So I thank you and I thank the NPKUA for providing this platform and for moderating tonight. And I really, guys, thank you for your time and spending it with me. I really appreciate it.
All right. Well, thank you. Everyone have a great evening. We'll post on our social channels once it's available on YouTube. You can watch for it there. And then we'll be able to send the slides out to this distribution for those that registered tonight. So, all right. Thank you very much.
Thank you, guys.
Mhm.